right, Ben, you're called to FFC for someone who was found unresponsive and not responding to anything.
Is the scene safe?
Scene is safe.
I've got my BSI in the form of gloves, mask, face shield. Number of patients?
One patient.
MOI, NOI?
MOI was patient, was found, and they're not waking up to any stimulus.
Okay. I'll consider additional research when I get on the scene.
Mm-hmm.
Okay, so my general impression is a patient about 20 years old, 20-year-old male patient who appears to be unresponsive, lying supine on the floor. That's what I see.
That's what you see.
Okay, at this time I'm also going to call ALS for an unresponsive, for appearing on constipation. Sir, can you hear me?
No response.
Squeeze my hand if you can hear me.
No response.
Clavicle pinch?
No response.
Okay, I'm going to call an AED, O2, and I'm going to administer glucose via the buccal method.
All right. Oxygen is unseen.
Okay. Do I have any reason to suspect C-spine?
No C-spine situations.
Okay, I'm going to do a head tilt, chin lift, and listen for breathing.
Head tilt, chin lift. Oh, you get no breathing.
No breathing? Okay. I'm going to give 2 exploratory breaths. I'm going to attach my BVM to the O2 and at 15 liters per minute. You actually want me to set up the O2 or can I just verbalize it and set up?
No, it's not set up.
It's not set up, okay. Okay, I'm going to give 2 exploratory breaths.
All right, breaths go in.
Breaths go in?
Mm-hmm.
Okay. I'm going to secure the airway with an OPA. You want me to measure it?
Yeah.
Okay. I'm going to measure from the side of the mouth to the earlobe. Box open. Okay. Measuring from the earlobe to the side of the mouth. And then I'm going to use a tongue depressor, hold the tongue down. I'm just going to slide it straight out. Okay?
Slide it.
Does it actually fit this? Okay.
It's a tongue depressor, not a pot depressor.
Okay.
All right, patient gags.
All right, I'm going to remove the OPA. I'm going to get an NPA. Measure that from the side of the nose to the earlobe. Okay, I'm going to use a water-based lubricant to lubricate the NPA, bevel pointing towards the septum, and I'm going to put it in the right nostril.
All right, you're gonna have lube when you do your scene tomorrow.
Okay.
Just pretend it doesn't.
Okay, cool. Okay. Checking for pulse.
Patient already had the pulse. Check for the pulse right after you give the 2 breaths, by the way. Don't wait and intervene with the airway until you're sure that he has a pulse. Otherwise, you have to start doing something. So
Okay.
patient had a pulse.
Patient had a pulse. Okay, I'm going to then continue rescue breathing.
Patient starts vomiting.
Okay. Then I'm going to suction with my manual suction or my mechanical suction. I'm only going to go as far as I can see. I'm going to suction on the way out and for 15 seconds maximum.
Okay. You hear no more gurgling.
I hear no more gurgling. I've removed everything. Okay. I'm going to continue rescue breathing at a rate of 1 breath every 5 to 6 seconds.
All right, your oxygen arrives on scene.
Okay. I'm going to confirm it's oxygen. It's got the green top. I'm showing it's oxygen. I'm going to give the tank 1/4 turn to crack it and then close it. Set the regulator to 0. The regulator's closed. I'm going to open the tank. I'm going to ensure if there's 1 to 500 psi. I'm going to open the regulator to 25 just to clear the dust. Close it. I'm going to attach it to my BVM and set it to 15 liters per minute. And I'm going to continue rescue breathing.
All right, what are you going to do after 2 minutes?
I'm going to reassess for pulse and breathing.
Okay, so when you reassess, patient is breathing at a rate of 8 breaths per minute.
Okay. Now I'm going to get my NRB. I'm going to attach to my oxygen at 15 liters per minute and put it on my patient.
And also remember, you have to fill the bag before.
Right. I'm going to fill the bag 1/2 to 3/4, and I'm going to put it on my patient.
When would you use a nasal cannula monitor?
If the patient rejects the NRV.
Okay, and you're done.
Cool.
All right, so as opposed to us seeing you how to deliver the BVMs in the CPR scene, this scene we're more concerned about how you use all the other supplementary equipment. So the airway adjuncts, delivery, connecting of the oxygen device. You need to know your flow rates for each of these, okay? All right,
when you're not using the oxygen tank, make sure to lay it down wide.
So this goes in one.